Hi, good evening, everyone. Welcome to Sincere Healthcare Group Facebook live streaming. And today we have Professor Ng Sun Chai, a fertility specialist with the title of the father of IVF Asia with us. And for today's topic, we will help couples who are trying to start a family to understand the different fertility treatment that is available. And thank you, Prof, for making times to come down for our Facebook live streaming. Prof, we understand that there are different fertility treatments such as IUI and ICSI in Singapore. And are these the only treatment program available in Singapore? And what is the process for this program? And what is the process of this program?
Yes, thank you for inviting me again. The treatments for infertility, of course, vary from the very simple to the most difficult. So there's a spectrum. The simple ones will be like giving medication such as clomiphene or letrozole, and then let the patient try to ovulate on their own. For patients who have polycystic ovarian disease, maybe metformin to try to treat their insulin resistance, and then they ovulate on their own. All the way to the most sophisticated and difficult ones, and that would be what we call assisted reproduction. So assisted reproduction actually is a general term that encompasses the need to take out the egg out of the body. This is a definition which we actually defined in when we wrote the book, or when we had a series of infertility procedures, and we wrote a book, and we defined assisted reproduction as the procedures in which there is a need to take out the egg out of the body. So IUI is not actually an assisted reproduction, but IVF, ICSI, the former procedures such as the gift or gamete intrafallopian transfer. So the processes obviously will vary. The very simple ones, you don't need to take any special procedures. It may not even be necessary to come down to the hospital or to the clinic to see the doctor. Yeah. But the between IUI and assisted reproduction, IUI is more simple. Basically, you just need to time the ovulation, and then when the patient is about to ovulate, the husband needs to come down to the hospital or to the clinic to give the sperm, and this sperm is then processed, and intrauterine insemination is done. That means you put the sperm into the uterus. Then the sperm has to do its work or its job, designed for what is to be done. So it will swim up all the way to meet the egg, probably in the fallopian tube, and fertilize the egg, and the embryonic development will occur in the body, in the fallopian tube, and when it reaches the blastocyst, it will then implant in the uterine cavity. So that is the process for the IUI. For IVF is definitely different. IVF, you need to have more injections. The wife needs to have more injections, hormone injections, to create more eggs. So the first thing is that the number of eggs you want for the IVF or assisted reproduction techniques definitely needs to be higher. the reason why for IUI you don't want to have so many eggs is because you can have high order multiple pregnancies. So this like quintuplets, quadruplets, sextuplets, all these high orders is because of the higher number of follicles that ovulate when you give medication, and then you do IUI, or if they have a normal intercourse. Yeah, so you cannot restrict the number of embryos implanted. Whereas IVF, you collect all the eggs, you fertilize the eggs outside the body. So you create the embryos, then you freeze the embryos, and you put back one or you put back two. Maximum is two. So you therefore prevent high order multiple pregnancies. So basically that is the simple forward difference between IUI and IVF.
Okay, and are there any side effects for such fertility treatment?
Yes, definitely. All this depends on the amount of medication you give. So for IUI, because you do not want so many follicles, you give minimum stimulation. So you give maybe letrozole or clomiphene. You can add low dose gonadotropins or FSH. The commercial forms will be Gonal-F or Purigon. And then you give the trigger dose for the ovulation. Yeah, so because you baby have 2 follicles, 3 follicles, the patient do not have so much side effects. You don't have hyperstimulation like problems. But in assisted reproduction, you give higher doses of gonadotropins, and some on average patients can get about 10 eggs collected, 15 eggs collected, but some patients may end up with 20, 30, even 40 eggs. So these patients have very swollen ovaries, very uncomfortable feelings. There'll be a lot of distension. So previously, maybe a decade ago, when the medications are not so not as sophisticated as what we have now, the patients can get what we call ovarian hyperstimulation syndrome, or OHSS. So these patients need to be admitted to hospital, and in the more severe cases, we even do what we call paracentesis. That means we put in a tube into the abdominal cavity and drain out the excess fluid, or what we call ascites, excess fluid in the abdominal cavity. So that all very severe. A lot of morbidity, and in long hospital stay, maybe 2 weeks, 3 weeks even. Yeah, so that's a problem. So in addition to the long stay, there's also the cost element. Yeah, it's quite expensive. However, now, like I say, the medications are more sophisticated, so we can get hyperstimulation, but we don't get OHSS. All right, so we get a lot of eggs, and we can create a lot of embryos, but you prevent the classical OHSS syndrome. So the patients will have some discomfort, some swelling, but the menses will come usually within a week, because we give medication to cause the menses to come early. So when the menses comes early, then the ovaries will subside. They won't be so swollen. Then there will be a faster resolution for the patient. Yeah. The danger, there's a very big danger about having these big swollen ovaries, and that is ovarian torsion. The ovaries can twist on its own pedicle, so that will cut out the blood supply to the ovary, and the ovary actually dies. This is a very severe complication, and that requires an immediate operation because the patient will have very, very severe pain, what we call acute abdomen. So they have to go to the emergency department, hospital, patient needs to be admitted. A laparoscopy needs to be done, that means an operation, keyhole surgery, to identify that the ovary is undergone torsion, and then you just need to untwist the ovary. You don't need to do anything more. However, if it is too late and the ovary has become what we call anoxic, that means the blood and the oxygen supply has been cut off for too long, and the whole ovary will undergo necrosis, then you have no choice but to remove the whole ovary. So that is the big danger.
And we understand that there are some patients who have undergo a few times of IUI, and it was not successful. For such cases, what is the next recommendation step for them?
Okay, for IUI, the general recommendation is not to do beyond 3 cycles. And the reason is when the life table analysis is done, the pregnancy rates increase all the way up to the 3rd cycle. Then from the 4th cycle onwards, it plateaus off. So, in other words, there are no new pregnancies after 3 IUI attempts. So, we generally do not recommend that you do more than 3 times of IUI. So if you still do not become pregnant after the 3rd cycle of IUI, the next step is actually IVF or assisted reproduction, because the pregnancies do not increase anymore after the 3rd cycle.
So what are the alternatives of IVF?
Okay, it depends on the reason why the patient cannot get pregnant, because IVF is the ultimate treatment, so to speak. Yeah, it's the best treatment that's available. But please remember that IVF is a general term for assisted reproduction. So you have ICSI or ICSI as part of the IVF group of treatments. You can have donor eggs, and then you use the donor eggs with IVF. You can have different types of procedures, like for instance maybe for patients, these are all patients with very specific problems, like for patients who are much older, where there is a higher chance of abnormal embryos. You can do things like PGTA to exclude chromosomal abnormal embryos. So these are called aneuploid embryos. So you exclude them. So all these are all still part of IVF. So what is beyond IVF? That means you try all kinds of things with IVF and still cannot get pregnant. Then I'm afraid, again, like I said, it depends on the cost. So if the patient really has got very poor quality eggs, then of course you have to use donor eggs. You have no choice. If the patient has got very thin endometrium, and they can get good quality embryos but still cannot implant. Then in the worst case situation, maybe you have to offer surrogacy. Surrogacy is not legal here in Singapore and in this part of the world. So the patient may have to go to countries where surrogacy is legal, like in the US or in certain parts of Europe. It depends on the type of cost. Yeah. So there are many different new advances. Like for instance, even uterine transplants. So for patients who have very severely scarred uterus and cannot regenerate new endometrium, she may need uterine transplant. Or patients who have no uterus, born without the uterus, what we call uterine agenesis, then you may need uterine transplant. Things like that. So these are all major advances coming. Other major advances included the possibility of mitochondrial transfers, or what we call the three-generation or three-parent family, things like that. Okay.
So what are the additional treatment or procedure that may be recommended?
Procedures, okay, I think as part of the workup to determine whether or not the patient has got infertility cause, then most of these procedures would have been done. But again, it depends on the cost. Yeah. So, say for instance, a patient has got very big fibroids, and she has generated good embryos. So sometimes it may be necessary to remove the fibroids before you do the transplant or transfer of the embryos. So removal of the fibroids usually done surgically, but now there is embolization, where you actually cut off the blood supply to the fibroids. So you shrink the fibroids by 50-80%. Then the chance of pregnancy hopefully is better, and you can do a uterine transfer after that. So these are all possibilities, but it depends greatly on the reason why the patient still cannot get pregnant.
And what is the success rate for IVF?
That varies a great deal on the age of the woman. The younger the woman is, the higher the chance of pregnancy. That's why for egg donors, most of the egg donors are less than 30 years old, even early 20s, then the chance of pregnancy is very high. So generally for that age group, when you put back one blastocyst, usually pregnancy rate may be 50%, around 50%. As a woman gets older, the chance of pregnancy gets lower. So our center, it varies from center to center. So for our center, with patients above 40 years old, the chance of pregnancy is between 25 to 35%, which is very good. However, at that age group, there's a much higher chance of miscarriage due to aneuploid embryos. So the chance of miscarriages or abortions much higher, maybe in the region of 25 to 35%. Yeah.
So And thank you, Prof, for coming up to our show. And we will see you next time.
Thank you.
Yeah,
It's
thank you.
my pleasure.
Thank you.
Thank you.